sores will disappear. Then, the victim may relapse into the second stage and sores may appear.
The disease begins to attack the heart, the blood vessels, and the nervous system.
1 out of 3 patients with latent syphilis passes into the final stage, tertiary syphilis.
Within 10 to 30 years from the time of infection, the heart, brain, and spinal cord are irreparably affected. This is evidenced by blindness, an inability to coordinate muscle movements, and even insanity.
Each year, about 1 million American men and women contract gonorrhea, a bacterial disease also known as the clap.
With gonorrhea, symptoms appear 3 days to 6 weeks after infection. Males are more likely than females to exhibit symptoms, which may include a whitish discharge from the penis, tender and swollen glands, and a burning sensation when urinating. About half of the women with gonorrhea have no symptoms. Possible symptoms that may appear include slight vaginal discharge, a burning sensation during urination, abnormal menstruation, and abdominal pain or tenderness.
Just because symptoms go away does not mean that the disease has disappeared.
If not treated, or if incompletely treated, the disease can spread through the body and cause a high temperature, sores on the skin, and pain in the joints. Sometimes joints, heart valves, and tissue around the brain will become infected. Scarring of the reproductive organs by the infection can cause infertility. Herpes is an especially frightening disease because it is incurable.
It is caused by 2 different but closely related viruses: herpes simplex type 1 virus and herpes simplex type 2 virus.
Both types of herpes are transmitted by sexual contact. Herpes 1, also called oral herpes, usually shows up on or inside the mouth in the form of cold sores or fever blisters. Herpes 2, or genital herpes, usually consists of a cluster of blisters on or around the sex organs.
The first outbreak of genital herpes is usually the most severe.
Common symptoms include painful, itching sores in or around genitals, fever, and a burning sensation during urination. These symptoms appear 2 days to 3 weeks after the virus first infects the body. They persist for a while, disappear, but then flare up again weeks, months, or even years later.
In addition to sexual contact, simply touching and kissing can transmit herpes from one person to another. This causes the disease to spread very easily. When blisters are present, herpes is highly contagious and transferable to a sexual partner. However, the disease may be contagious at any time. Hepatitis B is a viral infection that affects the liver. It is transmitted through exposure to body fluids, such as those in contaminated blood transfusions. Needle sharing among IV drug users and sexual contact can also transmit the virus.
The virus that causes hepatitis B can cause 3 basic types of infections. One of these is a silent infection in which there are no symptoms. The other 2 are acute hepatitis and chronic hepatitis. Symptoms of hepatitis include fatigue, loss of appetite, nausea, vomiting, fever, and headache.
The skin and or eyes may also take on a yellowish tint in a condition known as jaundice.
Both acute and chronic hepatitis B can cause liver failure and death.
There is a vaccine for hepatitis B, but it is not 100% effective. HPV, or human papillomavirus, is most commonly known as genital warts. Human papillomavirus is a subtype of the virus that causes other warts on the body. Warts that are spread by sexual contact, however, are found on the genitals. Genital warts are very contagious, and since they can take over 6 months to develop, it is possible to spread them without even knowing one is infected. Signs of infection may include small bumps or clusters of bumps on the genitals, or itching, burning, tenderness, or pain in the genital area. It is very important to see a doctor if you believe that you are infected with the human papillomavirus. If left untreated, genital warts can cause cancer of the cervix, vulva, penis, or anus, all of which can lead to death. HIV, or the human immunodeficiency virus, attacks the immune system, leaving the body vulnerable to a variety of life-threatening illnesses.
These are called opportunistic illnesses caused by common bacteria and viruses that in a normal healthy person would not cause a life-threatening disease.
A person is said to have AIDS, or acquired immune deficiency syndrome, when he or she is infected with HIV, has a low helper T, or disease-fighting cell count, and has one or more illnesses indicative of AIDS. Transmission of the virus occurs through sexual contact, which includes oral, vaginal, and anal sex, via blood, through transfusions or needle sharing, and from a pregnant woman to her fetus, or from a nursing mother to her baby. The infection is not spread by casual contact, such as hugging and touching, by inanimate objects such as dishes or toilet seats, or by insect bites.
HIV infection may produce no symptoms at all for up to 10 years before a person is diagnosed with AIDS. Symptoms of HIV infection are actually symptoms of any number of opportunistic illnesses and may include prolonged, unexplained fatigue, swollen glands, fever, changes in bowel habits, body aches, and headache.
AIDS is a deadly disease. Once a person is diagnosed with AIDS, he or she may live for only a few months or for several years. In order to avoid HIV infection, follow these effective, life-saving guidelines.
Practice abstinence, or do not have sexual intercourse with a person who is either known or suspected to be infected with AIDS. Never engage in sex with multiple partners, a person who has multiple partners, or a person who uses IV drugs. Do not use intravenous drugs. Failing this, do not share needles or syringes. Avoid exposure to blood from injuries, nosebleeds, and so on, where the HIV status of the bleeding individual is unknown. Wear protective clothing when caring for people who are injured. People with AIDS or individuals who test positive for HIV may pass the virus on to others and therefore should not donate blood, plasma, body organs, or sperm. From a legal, ethical, and moral standpoint, HIV carriers should warn any prospective sexual partner of their HIV positive status.
Section 4. Making sound decisions, avoiding the consequences. To avoid the emotional and physical consequences of premature sexual activity, it is best to abstain from sex. You may be abstaining while waiting for the appropriate age or for the commitment that marriage provides. The decision to have sex can be made at any given time in your life. Don't rush into a situation you may regret later. Even if you are already sexually active, you can decide now to practice abstinence and thereby protect yourself from the negative physical and emotional consequences of teen sex.